we have one that is working for everyone, one that is working for every hospital, every clinic. There's now this problem of there's too many of them. They're not talking to each other. There's not interoperability, and now communication and continuity is getting lost. So 100% agree with that on you with you, sorry, Carl, that in terms of technology, in healthcare, it needs to be really um, created with the people in mind, especially because doctors, nurses, MAs, they need so much of that face-to-face interaction with patients. And if they're spending 30 minutes clicking around and documenting in a system that really takes up their time and it really is not efficient, it's taking away from that human connection that is so needed.
Your business's success depends on relationships, relationships with customers, relationships with employees, and relationships with stakeholders. What do they all have in common? They're all human. Because no matter if your business is B2B or B2C, it's really H to H, human to human. Welcome to the Human Connection Podcast. I'm your host, Karl Pontau. Each week, I'll bring you stories, insights, and practical advice from experts that you can apply to your growing company and daily life. This week, I'm excited to connect with Sulay Thompson. She is a healthcare operations executive with nearly 2 decades of experience transforming organizations through operational excellence and human-first leadership. She has built and scaled patient support operations from the ground up, tripling patient activation volume in under 8 months, driving efficiency improvements of more than 35%, and consistently achieving satisfaction rates above 95%. Sulay has led cross-functional initiatives across clinical, product, and engineering teams to streamline onboarding, enhance adherence, and reduce escalations, directly impacting both patient outcomes and organizational growth. Throughout her career, she has created and implemented scalable SOPs, training programs, and performance management frameworks that strengthen provider relationships, improved access to care, and ensured clinical integrity across diverse specialties, including primary care, fertility, internal medicine, and gynecology. She has managed and mentored teams of up to 100 professionals, cultivating a culture of collaboration, transparency, and accountability. Sulay's career achievements reflect her exceptional ability to transform chaos into clarity, streamline inefficient workflows into high-performing systems, and deliver measurable impact across the provider and patient journey. Her track record demonstrates not only her operational expertise, but also her ability to lead organizations through growth, change, and innovation with lasting results. Congrats on your exceptional ability to transform chaos into clarity, and welcome to the Human Connection Podcast.
Thank you so much, Carl. I'm really happy and excited to be here today. Really honored to be a guest. So thank you very much for having me, and really looking forward to our conversation today.
Yeah, I'm excited to have you on the show, and I think it's great for us to chat about finding it. So right now, like a lot of companies have been focusing on like efficiency the last 2 decades, especially like in healthcare, trying to speed up things, but it's been often at the expense of the human side of the business. And so there's now a movement to bring back more empathy and a human-centered focus to the business. So what is your experience, or how do companies balance that efficiency and empathy side of things to form a more healthy relationship between employees and patients and the like?
Absolutely. Yeah, I think you hit the nail on the head, Carl. It is true. I think all different industries, not just healthcare. Healthcare is what I know because I've been in it for 20 years so far. But I think there has been a drastic movement in how do we make it more efficient? How do we make it faster? How do we make it more effective? And behind all of that, there is that human component that a lot of times gets lost and a lot of times gets forgotten, which then adversely impacts the efficiency, the operations, the processes. So all in all, I do understand that everything is a business, that we need to have outputs, that we need to have KPIs, OKRs, but I think it's really important to keep in mind that behind those processes, behind those that efficiency are human beings that have feelings, that have bad days, that have good days. It's the humans driving the process, not the process driving the humans. So I think if we zone out a little bit and we take care of the underlying or the moving force, which is the humans, then everything else follows. Everything else completely falls in line because these are the ones that are driving that car of efficiency. I always say, it's we're humans first and employees second. It's always important to take care of that human being and really be able to make sure that we are tailoring our approach to that human being, whether it's a client, whether it's a team member, whether it's a patient, but really being specific to that human being and what that relationship looks like, what that relationship needs, and what that relationship what the goal of that relationship is. I think if we look at it at that lens first, then we are off to a better start than looking at okay, this is my end goal and this is the process. Because like I said, humans are the ones that drive the process, that drive the relationships. It's not the other way around. And that's what I've been trying to really put forth in healthcare and put forth in every interaction I've had with clients, with patients, with team members, is really understanding what is behind that and really being very nuanced when it comes to each and every one of those relationships, not treating it like a one size fits all kind of thing, and not treating it like this is a framework, I need to approach it like this every single time, but utilizing that framework as my foundation and then really truly being very nuanced to the person, whether it's the client, the team, my boss, whoever it is, and really being very respectful of who that person is, what they bring, what their challenges are, and how I can create a sustainable relationship with them from the beginning, if that makes sense.
Yeah, I think there's a lot of the same sort of uh, misaligned approach that a lot of like tools that are like people are trying to sell to like healthcare systems and stuff. They're not designing it with the clinicians in mind or with the patients in mind. They design it as like, look what this tech can do with this amazing process. It doesn't actually work in practice
Yes.
because they're not designing it with an understanding of what the clinician's existing work experience is, like what it's like to actually work in a hospital or in a clinic. And so the same thing with with any sort of like behind the scenes, like back end systems for businesses, if you're designing it without understanding the users and getting their input from the design phase onward,
Yes.
like initial design phase, then you're asking for trouble because it might look good on paper and might seem super logical, but the actual reality of how it's being implemented and where it's implemented doesn't fit with your initial view, then there's going to be this huge mismatch and it's going to be a disaster. And we've seen that all over the place with, I think it's like 70% of all tech like rollouts are failures, not even just like in AI or healthcare, but just in general, because companies aren't designing them with people in mind. They're designing them with their process in mind. And so there's this fundamental misunderstanding or kind of breakdown of how to design these tools and how to implement them on the actual like rollout step. And it's frustrating to see so many companies keep stepping on the same rake as before, because it's not like a new problem or a new mistake, but one that they're not seeming to learn from. And so I think it's long overdue of a solution.
Absolutely. I 100% agree with you on that, Carl. And I think, when you're saying that, what comes to mind is the rise and the then expansion of EMRs, electronic medical records, right? So I've been in healthcare way before we had EMRs, where it was all paper charts and we had to do filing and faxing manually. And I was very lucky and very blessed to be part of healthcare once EMR started taking off. And it was great. It was technology. Everybody was excited about it. No more filing, no more papers, no more storing. But my first 10 years of my career were very clinically based. I worked really closely, hand in hand, right hand with doctors, with PAs, with NPs. And something that I slowly started to see is that we had the shiny new technology, EMRs, and they first were very excited about it. But as the years passed, it really became a little bit more of a nuance to that. And I remember some doctors saying, Sue, there's too many clicks. I just don't have the time to do it. Or it's taking away from my really facing the patient, sorry, and really making sure that I can talk to them. I have to do all this on this EMR. I remember I even had a doctor back then. I remember him dearly. He refused to use it. I had to go in there and put in everything for him, the vitals. I had to put the testings we did, just everything, and then he signed off on it because it just took too much of his time. And I think that problem has perpetuated throughout the years, and that's why we've seen the rollout of so many EMRs out there, because it's the same issue with doctors and nurses saying, it takes up too much time. It's too complicated. It's not conducive to me giving the best patient care that there is. And I sit back and I think, and when I go on interviews, they ask me, are you familiar with EMRs? And I tell them, yes, I've actually utilized up to 10 of them. And just the fact of me saying that there's about 10 different EMRs out there really highlights that the problem perpetuates, that it's a technology, it's amazing, but it's not conducive to a lot of what the doctors, the nurses, the medical assistants need out of that technology for them to be able to say, you know what, we have one that is working for everyone, one that is working for every hospital, every clinic. There's now this problem of there's too many of them. They're not talking to each other. There's not interoperability. And now communication and continuity is getting lost. So 100% agree with that with you, sorry, Karl, that in terms of technology, in healthcare, it needs to be really created with the people in mind, especially because doctors, nurses, MAs, they need so much of that face-to-face interaction with patients. And if they're spending 30 minutes clicking around and documenting in a system that really takes up their time and it really is not efficient, it's taking away from that human connection that is so needed and it's like at the center of what healthcare is.
Yeah, and it's the problem that isn't just affecting like the bottom line for a business. It's like this is costing people their lives because they're not getting the quality care, and physicians are burning out because these tools that are supposed to be helping solve a problem are just making it worse
Yes.
because they're not being designed with clinicians in mind, or they're not understanding the experience of how they're actually being used in the field. And it seems like I've heard there's some like automated tools that are sort of like with some little AI that's helping kind of like fill in some of these forms, but it doesn't seem like something that if you actually just kind of sat down and designed it with clinicians to get a sense for like how many clicks they need, or what sort of things could be, how they would want to use it.
Yes.
First, that it wouldn't need to add in more layers of complexity to try and solve something when just rebuild it from the ground up with a proper foundation of your clinician first design. And it's so when you're working with companies and helping like design these systems, what is, besides initially just like starting with the clinicians in mind, what's kind of your approach that leads to the success you've had with the companies you've worked with?
Yes, that's a great question, Carl. Thank you for asking. I think the approach is just a very humanistic, very tailored approach to the connections and the relationships I make. I think that it's really important, especially in healthcare, which is really complex and it has many layers, many different people doing different things or different, for lack of better words, different specialties. I think it's really important to be very mindful of one, how everybody is different as a professional and as a human, and respecting that instead of forcing everything and everyone to be in this mold that or this vision that we have. I think it's very important, of course, that we all come together under one mission, under one vision, and we are all towards one goal. But I think the approach to that has not always been the best. I think the approach to that needs to be yes, there's one mission, there's one vision, but we need to respect and incorporate that diversity of not only race, but thought, of experience, of background. That has created immense value in the companies that I have worked with. It has created immense I want to say really great results and collaboration. I think once I've learned that it's not about fitting anyone, it's about just really welcoming that and saying, okay, you come from this area, I come from this area, you have these thoughts, I have these thoughts. Now, how we can bring these together to make that better than bigger and more efficient and more effective. Actually, the last 10 years of my career have been really a lot in healthcare tech, just because I appreciate companies, especially startups, high growth companies that see that there's a problem, a fractured problem with healthcare and are really trying to fix it. And in healthcare tech, I've encountered a lot of engineers that are brilliant. They're so brilliant. I've seen that, of course, they speak a whole other language other than operations, than client success, than finance. They have a whole different field of expertise. And the way that I've been able to be successful with them, like build products and roll them out in terms of SaaS, has been by respecting that and saying, okay, you think this way, you look at things this way. Maybe I'm not really capturing what you're or understanding where you're coming from. Explain it to me, and then me explaining from the operations client success, and then meeting in the middle of okay, now we understand each other, we understand we have these different perspectives, we understand we have these different languages, but let's collaborate together in one, and let's figure out how we can move forward together in alignment. So long story, I know I rambled a little bit there, I'm so sorry, but long story short has been my success has been in not forcing anyone to be or to do what they are not, just respecting them for who they are, what they bring, finding value in them, and saying, okay, we're different, but that's not a bad thing. That actually is really good. So if let's get together, let's put our minds together, let's come up with something brilliant together, aside from just having forcing them to fit something that they're not, or then having everyone think the same. I think if you fill a company with just people who think the same, who do the things the same, there's no innovation, there's no growth, there's no friction that can lead to even greater opportunities or greater discoveries. So it's about the human and the professional and just respecting their differences and applauding that and welcoming that in a culture of diversity, of acceptance, and of just uplifting that.
Yeah, I think it's a great point about how engineering has a certain vision for the tools,
Yes.
but then client success and operations have a different one, and it's one extreme or the other is not going to work because of all the different factors involved. So you got to find that healthy middle ground. And it's not necessarily like halfway in between, but it's finding the right balance for
Yes.
the unique situation for the client or for the company you're working for, and the other factors like budget and time frame and a whole different things. So it's not an easy balance to find, but when you don't strive for that balance and go either
Mhm.
all on like the engineering side or all on the operations side or one of these extremes, you're destined to have a lot more problems and probably fail because you're
Yes.
not able to accommodate the needs of the different stakeholders involved.
Mhm.
And so it makes a lot of sense that your approach is one of, hey, let's make sure I understand where you're coming from, make sure you understand where I'm coming from. And even though we speak in a different languages and different priorities,
Yes.
finding a healthy middle ground and moving forward will create the highest degree or highest chance of success for this tool and for the clients and eventually the patients and the people that are relying on these physicians to stay healthy and alive.
Absolutely. And I think it's so important to highlight how it's really important for companies and teams to have that person that is kind of the middle ground, whether it's operations or client success. Because I've been in companies, right, and especially healthcare tech, where engineering is like, I have built the most amazing thing. It's brilliant, and it really is. It really is. But then you put it in the hands of clinicians or you put in the hands of a client and they're struggling with it because maybe they don't think the same way or they don't see it the same way. And then I've been in other companies where operations is like, this is exactly what we need, this is what the client, the team needs. And then engineering comes back and they're like, that is not possible, or yes, that is possible, but it will take about 4 months for us to develop that. And it could go either way. So I think kind of finding that middle ground or that middle person that can bring what engineering is saying or wants to do, bring what operations also wants to do, what their goal is, and lead those two goals towards a common ground is very, very important. I was lucky to be part of a company that they were building a technology for healthcare, especially for clinicians. And basically, I really interacted with engineering. And one of the things that I really appreciated about the company was the fact that, I would talk back and forth to engineering. I think this would be better for clinicians. And engineering would tell me, okay, Sue, but in order to do this, we need to do that. And I would say, okay. And we would go back and forth. And then eventually they created kind of a sandbox for me. So a sandbox environment where I can test things from another perspective and say, okay, now that this is created, let's see how it translates to maybe an MA or a nurse or a doctor utilizing this. And I think that was very successful because of that back and forth, that diversity of expertise, diversity of thought, diversity of skills. And I think that that's maybe the missing mark in many, not many, but some companies where engineering really is really brilliant, and then operations really is brilliant as well, but there's no middle ground. So you end up on two parallel paths. Either you get something that operation needs and engineering can't do right now, or maybe can do in 4 months, or you get a product that no one knows how to really utilize, and they can't appreciate the hard work. And when you get those two parallel paths, you get a lot of missed work, a lot of misutilization of resources, and it affects the company, the team, the resources, the timeline, the clients, the patients. So it's about merging those two lines instead of being parallel to each other.
Awesome. Well, thank you so much for connecting with me today, Sulay. If you enjoyed this episode of the Human Connection Podcast, please like, leave a review, and share it. If you'd like to connect with either of us, check out the links in the show notes. And remember, no matter if your business is B2B or B2C, it's really H to H, human to human. Happy connecting.